This week on Healthy Living, the WHO approves a long-awaited malaria vaccine for children. We'll have more. And what is your opinion about the first malaria vaccine? Your reactions coming up. Plus, experts are sounding the alarm. Social media may be causing Tourette-like symptoms. These stories and more in this edition of Healthy Living. Hello, I'm Lina Humudu. Thank you for joining us on Healthy Living. It is a major milestone. The World Health Organization has recommended the use of the RTSS or Mosquirix malaria vaccine, the first one against the mosquito-borne disease. This is following a pilot program deployed since 2019 in Ghana, Kenya, and Malawi, where more than 2 million doses of the vaccine were given to 800,000 children. Malaria is caused by the Plasmodium parasite and spreads to humans through the bites of infected mosquitoes. Symptoms include fever, headaches, and muscle pain. The disease can be deadly if left untreated. According to the WHO, about 400,000 people lose their lives due to the mosquito-borne disease each year. Most of the victims are children under 5 in sub-Saharan Africa. Experts say access to the 4 doses of the RTSS vaccine is one of the challenges that many countries in Africa will face. Justine Moulin-Condestian gives us a closer look in this report.
While COVID-19 has been a focus for health officials worldwide for almost 2 years, Africa continues to battle malaria. According to the World Health Organization's estimates, malaria has been deadlier than coronavirus on the African continent and killed about 360,000 people compared with 212,000 confirmed COVID-19 deaths in the past 18 months. But there's some good news.
WHO is recommending the broad use of the world's first malaria vaccine. This recommendation is based on results from an ongoing pilot program in Ghana, Kenya, and Malawi that has reached more than 800,000 children since 2019. This long-awaited malaria vaccine is a breakthrough for science, child health, and malaria control. Using this vaccine in addition to existing tools to prevent malaria could save tens of thousands of young lives each year.
The RTSS vaccine Mosquirix is the only approved vaccine for malaria presently and requires 4 doses. Experts say this is a step in the right direction, but more needs to be done. They say one of the challenges will be mobilizing the funds to produce and distribute the vaccine where it is needed.
While ongoing threats to our existing tools, drug-resistant parasites, insecticide-resistant mosquitoes, innovation is needed not only to create new tools, but to better tailor our current tools to achieve maximum impact. The malaria parasite is a formidable foe, and while we are excited by this recent development, major battles remain.
Mosquirix is made by British pharmaceutical GlaxoSmithKline. Research is ongoing worldwide for more tools to prevent malaria, including a vaccine by scientists in Burkina Faso and Britain's Oxford University that has shown more than 70% efficacy in clinical trials, and genetically modified mosquitoes to stop mosquitoes from spreading malaria.
Dr. Akpaka Kalu is Regional Advisor for Tropical Diseases with the World Health Organization African Region. He discusses the RTSS vaccine and its significance in malaria control on the continent.
For the last 5 years, we've documented stagnation in the reduction of malaria burden in Africa. And now this vaccine comes in. It's part of the game changers we are looking forward to. So introducing this vaccine as part of other arsenals against malaria, not as a replacement. As part of the malaria arsenal, we are happy to support countries to deploy it, including in combination with other interventions. But we are happy that scientists have been able to catch the parasite in its game and have developed this RTSS vaccine and therefore hopefully prevent many cases, and more importantly, prevent deaths. We want to deploy this vaccine. At the same time, support ongoing work for a second generation of malaria vaccines. Introducing malaria vaccines, scaling it up in countries, should have a communication component that advocates for vaccination in children, all vaccines. We are looking at malaria had adopted a strategy of tailoring interventions. Look at the prevalence of malaria, look at the burden of malaria, and tailor the best interventions for districts and provinces in that country and in all countries. We're working with partners like Gavi and others to look at how to ensure that this vaccine is made available. Every effective and safe vaccine in Africa for malaria will be deployed. There is ongoing work on mRNA malaria vaccine. There are other vaccines in the pipeline. Any malaria 2 vaccine or any other innovation is welcome.
What are your thoughts on the new malaria vaccine endorsed by the WHO? How do you think it will impact the fight against malaria in your community? Here are your reactions on Facebook. Emmanuel Ayuza says, "We welcome this historic breakthrough, thanks to the researchers." Mahamat Saleh Tijani writes, "Childhood vaccines have shown their effectiveness. Imagine the current situation in our countries if there was no polio vaccine, for example." And finally, Abel Bosco Wena says, "The malaria vaccine from Burkina Faso is what we want." American pharmaceutical Moderna is the latest company to announce that it will produce COVID-19 vaccines in Africa. As efforts continue to address the continent's low rate of vaccination, Moderna says it plans to build a factory on the continent to make up to 500 million doses of mRNA vaccines each year.
Moderna says it plans to build a vaccine manufacturing facility in Africa to produce up to 500 million doses of mRNA vaccines each year. The company's co-founder, Nuba Afayen, confirmed that South Africa, Rwanda, and Senegal could be potential locations for the factory.
But I can say that what matters to us most is the conditions under which we could operate, that is the healthcare system, the presence of trained folks who can actually at least help us on some of the clinical testing that needs to be done, so there has to be some proficiency in that area.
COVID-19 vaccines will not be the only vaccine produced in the facility.
Now this facility, it's important to understand, will make many different vaccines because by the time it's up and running, it's not clear what the urgent need for COVID-19 vaccines will be, because these things take a few years. But what we're planning to do is to put the plant to make multiple vaccines such that in the future, if there is a pandemic, and there will certainly be, then we can very rapidly convert it to now make the pandemic vaccine and provide vaccine security on the continent.
Observers say discussions continue between drug makers and governments about waiving intellectual property rights for COVID-19 vaccines, which will help increase access in low and middle income countries. The African CDC reports that less than 5% of people in Africa have been vaccinated against the coronavirus so far.
A number of HIV-positive couples face various challenges. A major one is having children. Many are divided between the fear of not having children or their children having health issues. But thanks to scientific advancement and education, some couples choose to become parents and are able to have healthy children. We take a close look in this report by Daniel Michombero and Alex Katikataye in Goma, Eastern DRC. Story by Yeyet Mavinga.
Marlene enrolled in the pediatric care program for children with HIV/AIDS at the Hill Africa Hospital in Goma. It is through this program that her pregnancies and all of her children are being monitored. The 27-year-old mother and her husband are HIV positive.
I have been living with HIV/AIDS since 2010 and had my first healthy child that same year. The second birth is twins. One had tested positive and the other is in good health. Out of my 5 children, 4 are in good health. Only 1 is positive.
Dr. Yuladi Vindu has been working in the HIV/AIDS department for 15 years. In 2006, she opened a care service for children with HIV. There was nothing like it in Eastern Congo at the time. Motherhood has been a real challenge for HIV-positive couples. More than 45% of newborn babies are infected with the virus at birth. This discouraged many HIV-positive couples from having families. But things have changed.
Today in our cohort, we have 565 infected children who are on antiretrovirals. At first, the positivity rate was very high. In 2006, 2007, 2008, around 30 to 45% of these exposed children came out positive. But with our prevention of mother-to-child transmission program, we are below 2% positivity.
Associations of people living with HIV/AIDS in the city of Goma are also working to help HIV-positive couples cope with the challenges of motherhood.
We put the women we call mother mentors in the different health facilities. These women support their peers. They can be pregnant or breastfeeding. They also do home visits. We help keep the mother accountable for taking the proper medications and making sure she stays on top of it, so her child will not have HIV and will grow up healthy.
According to specialists, HIV does not seem to affect the development of the fetus. The main risk that women are exposed to during pregnancy is that of infecting the fetus. The average risk of mother-to-child transmission in women who do not take treatment is about 20 to 25%. To avoid having infected babies, it is recommended that pregnant women with HIV be followed by a medical team, which includes an obstetrician, gynecologist, an infectious disease specialist, and a pediatrician.
Doctors around the world have seen an unusual rise in Tourette-like tic disorders over the past year. Matt Dibble reports on how social media may be the trigger.
TikTok, the video sharing app, is the home of talented pets, dance challenges, and lately, a lot of videos about Tourette syndrome. Tourette is a neurological condition that causes people to make unwanted sounds and repetitive movements called tics. The TikTok creators have raised awareness about the condition. Videos with the hashtag Tourette's have been viewed over 4 billion times, but their popularity may have unintended consequences.
We were receiving, up to 17 referrals a week for young people who had suddenly developed tic-like behaviors.
Tourette syndrome is genetic. Males are more frequently affected, with tics typically appearing in early childhood and increasing over the years.
Whereas in these kids, predominantly girls, they reached a peak of severity within 1 or 2 or just a few more days.
The colleagues suspected that something might be triggering the wave.
When I started watching some of the videos, I have 5 kids who are doing this exact tic.
Over the past year, clinics in England, Australia, Germany, and the United States have reported a similar phenomenon.
The tics tend to start with big tics, big motor tics like hitting tics or scratching tics or arm flailing tics.
The videos may act as a model for people who are susceptible because of other factors.
A lot of the kids that we're seeing or that are being seen with these tics report pretty high levels of depression and anxiety.
And though some of the videos use humor, living with a tic disorder can be very challenging. As doctors consider the best approaches for treatment, the first step seems clear.
Well, the first thing we want to do is we want to have them take a break from social media.
Experts' recommendation to each other is to take a closer look at social media, as this study from the University of Chicago concludes. Knowledge of media content is essential in managing patients in the current environment.
For the latest news and coverage on the coronavirus, stay connected to Voice of America at voanews.com. You can follow me on Twitter at Linahmudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.